Welcome to Parif TV. I'm joined by Dr. Larry Najarian, the president of APO, and Dr. Matthew Nalbandian, both members of the community who are actively working to help the community, especially the Armenian Nursing and Rehab Center. Larry, we got your email the other day, and what we tried to do is try to bring it to the attention of the public as to what is the situation with the Armenian nursing home. And now that Matthew is with us, maybe we can clarify the situation, him being the vice president of the home. Tell us the situation.
Well, first, Easter Vartan, and thank you for inviting me and Matt to be with you today. I really want to thank Dr. Nalbandian for his work at the Armenian Nursing and Rehab Center. Doing an outstanding job. The problem with the Armenian home is really not specific to the Armenian Nursing and Rehab Center. It's the realization that in Bergen County, where the center is located, is ground zero for New Jersey. This crisis is unprecedented and it's overwhelming. It's like a tsunami to the medical system. What's going on in New Jersey is very similar to what's happening in New York. And we shouldn't be surprised that our healthcare providers, the nurses, the doctors, the support staff, are heroes in this crisis. They're on the front lines and they're helping support our community and the non-Armenian communities as best as they can. But we're all shorthanded. Just as an indication of how massive the problem is, in New York State alone, not only did I get messages from the governor of New York and the commissioner of New York and all the hospitals that I'm affiliated with in New York for help, over 85,000 volunteers from outside of New York have gone to New York to help out. These are retired nurses, retired social workers, retired physicians, retired healthcare providers of all type. So it's not surprising to us that the Armenian home, which is a microcosm of what's happening in the whole environment, is having the same issue. They've got wonderfully dedicated staff, but the staff is fatigued. Some of them are ill. And as a consequence, there's a staffing shortfall. But at no point is any of the patients that are in the home in any jeopardy. And the good news is many are healthy and do not have the coronavirus.
Dr. Matthew Nalbandian, what can you add to what Larry just said? You are the vice president of the Armenian home, and you definitely are abreast of the developments there and are very concerned, obviously.
Yeah, sure. Thank you, Vartan. Also, Larry, just a quick thank you to Larry, who has been really outstanding. I reached out to him a couple of days ago after one of our board meetings to discuss the home and what's been happening and the volunteers that are needed. And within a very short period of time, Larry has been instrumental in getting the word out there. So let me backtrack. The Armenian home is doing well in the sense that we are not stricken with massive amounts of coronavirus patients. In fact, quite the contrary. We have at present only 2 patients that are suffering from coronavirus. They are being isolated in their rooms, and the remainder of the patients are actually doing quite well and functioning as they have been. The issue that we have, as Larry alluded to, like many other facilities, is with our staff. As you can imagine, the patients that are in the home require a lot of attention, and on a daily basis, even without coronavirus. And so, you know, the staff are working very hard to take care of these patients. The staff are not immune to getting sick. So some of the staff members who have gotten sick have been staying home to avoid getting any of the patients sick. As everyone knows from watching the news, the elderly and those with comorbidities, medical comorbidities, are at the greatest risk. So the patient population in the nursing home are really at the greatest risk of getting the most severe forms of illness associated with not just coronavirus, but any other virus. And so our staff, many of whom have been working at the home for over 20 years and are really dedicated to taking care of this patient population, have been, taking care of themselves and isolating themselves at home. And so the remaining staff that are working obviously are working to cover those shifts and take that added responsibility. And I have to say that we are very lucky to have such a great and dedicated staff in our home, starting at the top with our director of nursing, Mari. Mari has really been instrumental in sort of leading our nurses and taking care of them, and all of the different people that work in the home. I think what the home needs is volunteers for backup. As these nurses are working and putting in extra time to take care of patients, they're getting tired. Some of them, as I've said, have been sick and haven't been able to come to work. And so we want to have a backup plan to help take care of the patients in terms of nursing staff. And so we've been asking the Armenian community, much like our governments have been asking for volunteers, for nurses, licensed nurse practitioners, CNAs, anybody with any sort of nursing background. And the Armenian home uses all of those different types of nurses to provide vital care for these patients. And so we are basically looking for a bullpen of individuals who can help staff as needed. And so this is the impetus for my coming on. This is the impetus for reaching out to Larry to try and get individuals on a list of volunteers that we can go to in the event that we need more staff, or we need to give some of our staff a rest. And really, this is where we're at and why we're doing this.
Larry and Matthew, you both speak about the volunteers and staff. The word volunteer is mentioned often, but the question is, are these volunteers in the state, in the city, are these paid volunteers?
Yes, so I'll answer at least from the Armenian home perspective. They're not volunteers in the traditional sense. They're obviously not employees of the home. But that being said, these are paid positions. So what we are doing right now for the nurses that are there that are working, when they're working extra shifts, they're actually being paid time and a half. So they're being paid for their extra time that's going in. As you know, and Larry, may touch on it as well, the governor of New Jersey has allowed physicians and nurses out of state to work in New Jersey. He has lifted any restrictions that are in place that would prevent somebody from crossing state lines to work. So, Bergen County and Emerson, where the nursing home is located, is very close to the New York State border and not particularly far from Connecticut either. So, nurses that live in those states can actually work in New Jersey at the moment and can work in the home. And yes, these would be paid positions while they're there. So they're volunteering in the sense that they're not our traditional employees, but they certainly would be compensated for their work.
I know there are many, many women and men who are very attached to the well-being of the Armenian home. And I know Ika Kuyumjan leads the Friends of the Armenian Rehab and Nursing Center. Have these people been contacted, and what specifically can you expect from Armenian families to do? Can you specifically tell me what can a person volunteer his or her services to the home?
Right. So the Friends of the Armenian Home, the Fa ladies, are certainly an important part of the home. My wife is also one of the Fa members. Ika Kaunjin, her daughter Lucy are also involved. Her son-in-law Khoren is also on the board. So it's a very involved, tight-knit community, much like any other Armenian community. In terms of volunteering specifically for the coronavirus situation, there's probably not a lot that they can do professionally, in the sense that we need, nursing professionals. It is wonderful to have, volunteers who can do other things for the home, but right now we're not allowing people to come into the home. We're keeping people out, much like other businesses, and social distancing and doing all the things that are required of us to protect the patients. So at the moment, outside of any professional help, there isn't a lot that can be done. I would certainly suggest that if there are any family members of the patients that are in the home, if those family members have the ability to call and speak to their loved ones on personal devices, if their loved ones are capable of doing that and FaceTiming, that would certainly be welcome. But outside of any professional help, there's not much that can be done for the home. Going forward, though, we would love to have more volunteers and more people get involved with the home once we sort of lift these restrictions of social distancing.
Larry, we all know you've been working very, very hard. I was talking to Matt before you came on the session, and thank you for all you do. You thank us, we thank you, of course. Larry, you've also been very busy with virtual town hall meetings. Could you tell us, how are these sessions?
First, thank you for recognizing APO, its board, and all of its members for their heroic actions. There are so many volunteers that are coming out of the woodwork, volunteering for our telehealth line to help stranded citizens who need care, to people coming up with creative solutions to needs that people have, like coming up with oxygen to be discharged from the hospital. So when this is said and done, I think we'll hear a lot about the very numerous individual acts of heroism that are being done. And I have to say, it's so heartwarming when we receive suggestions from California, from Ohio, from Florida, from Philadelphia, on ways to help our patients here. So this is really a team effort, and I'm just the tip of the iceberg, but there are many, many people behind me. In terms of the cooperation between Armenia and the diaspora, it's never been stronger. There has been a really orchestrated effort to exchange information and relief efforts between Armenia and the diaspora as never before. We're doing this with the recognition that resources are limited. We do not need multiple silos of benevolent activity. We need organized activity that meets a specific demand that's requested by Armenia. And I'm happy to say that the Armenia Fund has taken the lead and has been arranging airlifts of materials, protective personal equipment, and other supplies to Armenia. This is ongoing. The message from the engagement of the representatives of the Republic of Armenia has been truly astounding. They, led by Ambassador Nesessian, are extremely engaged. And what is so impressive to me is their profound concern for Armenian citizens that are stranded here, who are visiting relatives who cannot get home. They're making sure they're working with us closely. They're working with our sister organization in California and elsewhere to be sure all of the Armenians that are stranded here are finding a home. They're also asking how they can assist us here in America. So there's a lot of very active dialogue and engagement between the diaspora and Armenia. We've never been closer. And what I'm also happy to see is they, along with all the leaders of the nonprofits, the alphabet soup, from the AMAA to the AGBU to Fund for Armenian Relief, and a string of other organizations which really deserve a big shout out. We have been working together with the leadership to provide facts. In a crisis like this, we don't need mythology to make decisions on, we need facts. And I have to say that everyone has followed the leadership of our clergy and practiced social distancing, and their actions collectively, based on the facts that we, through these weekly seminars, we've had 5 so far, with the leadership, have been able to give them, they have clearly together saved lives. There is no doubt in my mind that many, many lives have been saved throughout the diaspora and in Armenia because of the courageous actions of our political leadership, our clergy leadership, our NGO leadership. And then we also have to big shout out to people like yourself who've been helping get that message out to our communities. These seminars are extraordinarily informative, and I think the ambassador from the United Nations, Najarian, gave us a good global overview in that we're all in this together and that we'll come through this together. And the government of Armenia is not only keeping an eye on what's going on and practicing social distancing, but also, like here in the United States, looking forward to the future on solutions on how we come through this crisis. What's life going to be like? What are the needs of the most vulnerable populations? What are the needs of the Armenian citizens once we get through this crisis? So I'm really encouraged by the enlightened leadership on all fronts in our community. I think we've never acted more together than we have now. I'd also like to take a moment to mention that we are going to have one of these public workshops for the Armenian public. It's going to be at 8 p.m. Wednesday. Announcements will be forthcoming momentarily, but it will be taking place this Wednesday. And if you need information about it, you can reach us at info@oppo.org. And if there is anyone that wants to volunteer for any of our programs, our telehealth programs, if there's anyone out there that is in need of medical care, in need of mental counseling, in need of prescriptions, in need of volunteering, either with us or for the Armenian Nursing Home, you can reach us at info@oppo.org.
You know, very recently, in fact, today maybe, I read the headline saying the Minister of Health of Armenia, Torosyan, I believe his name is, Torosyan, said, things are out of control in Armenia. That sounded very troublesome. Did you read that? Did you hear about this? Do you know anything about that, Larry?
So first, I have to say that Dr. Armen Torosyan has been an incredible leader. Armenia itself has never been in more learned hands. Not only he has a degree in public health, but he has 4 assistant ministers, each of whom has a degree in public health. And if there was any country that has been more prepared and more educated on how to deal with the crisis, it's Armenia. On hands. They've also taken unprecedented steps. They've done things that we cannot do here. They've actually admitted not only patients with identified coronavirus, but also the people they've come in contact with. So they've done a very good job at what's called contact tracing and isolating the illness. And there is no doubt that they have flattened the curve of disease in Armenia. And really have prevented a lot of deaths. Now, it is true, as of this morning, there are 937 cases in Armenia, and there are 149 people that have recovered. So it's there, and it's now in all of the Mars. There's no place that's spared. I think we are now entering a very interesting phase where there's the realization that if we do not get the economy going in Armenia and in America, our vulnerable populations may have a greater risk of dying and growing ill from the effects of a poor economy versus the effects of the coronavirus. So there's a very delicate balance going on here between the public health needs for practicing what we're doing, and we're doing it very well, the social distancing versus the needs of the state to keep it going. So that's where we are. It's a very delicate balance. I think, again, Armenia has never been in better hands. And thus far, the political leadership has demonstrated courageous decision making. And we're very happy to see that.
Dr. Matthew Nalbandian, you know, there is so much we can discuss. We have to wrap this up. Armenians have founded schools, churches, cultural centers, etc. I don't know if we are really prepared for this type of crisis, yet we, unlike many other minorities, have the likes of APO. I don't know if other minorities have an organization of doctors like APO as we have it. My question to you is, what is your words of advice to people listening to you as you wrap up this session? What would you like to share with the public? What should they know?
Well, I think, first of all, Armenians are a strong people. You know, we have survived atrocities. We've survived many, many difficult circumstances. And so more than most religious groups and most people, we are actually capable of overcoming a lot of adversity. And so that's in our DNA. And I think people like Larry, people like yourself who, you know, fight this fight, get the message out there, you know, prove that every day. You know, our board of directors, I failed to mention earlier, we're very fortunate. We have a wonderful board of directors at the Armenian Home headed by Andy Tarigian. And my message really is to, you know, continue to remain strong, to hold the values that Armenians really hold near and dear, which is, you know, family is important, our heritage is important, and we don't want to forget that. All these other things, you know, this crisis really makes you realize that a lot of things we worry about on a day-to-day basis are really irrelevant. And what matters is our health and taking care of our loved ones. And that's what we need to do. And I think, you know, organizations like APO, we are very fortunate to have them. We're very fortunate to have, you know, Armenians who are dedicated and give of their time for all the things you mentioned: schools, nursing homes, physician outreach, anything. So I would say just keep being Armenian and we'll get through this.
Larry, in closing, is there any message?
I love what Matthew said about let's continue to be Armenian and demonstrate the resilience that we have throughout the ages. I think, you know, there's Elizabeth Kubler-Ross said there are 5 stages of grief: denial, anger, bargaining, depression, and acceptance. And I think we all have to accept the situation we're in. It's unprecedented. And we need to accept the new normal. This is a marathon. It's not a sprint. It's not going to be over next week or the week after or the foreseeable future, but it will be over. And there is lots of light at the end of the tunnel. As we speak, there are multiple medicines that are in clinical trials. There's multiple treatments that are in clinical trials, and there are multiple vaccines that are in clinical trials. So there is no doubt in my mind that we will have an effective treatment for this disease, and we will have a vaccine for this disease. And there is an army of researchers and physicians working on our behalf 24/7 to get the solution. So our new normal is not going to be forever, but we have to accept where we are. For those of you that have had COVID-19, again, I want to express my sympathies for the impact this may have had on you and your families. It's not a stigma. This is something that is going around. If you have symptoms, call your physicians immediately. Don't wait till they go away. There are other problems that people have. Their heart disease didn't go away. Cancer didn't go away. lung issues didn't go away. If you have any other issues, please do not ignore them. Call physicians. If you cannot reach your physicians, please tell us in being generous. You can be part of the solution. There is something in your blood that help you successfully fight the coronavirus. And these are called antibodies. These are little proteins. Your antibodies that helped you survive can help others overcome this disease. There is a national effort to find people like you that have recovered and have you donate your blood up weekly even, so we can use your antibodies to help other people that are critically ill. For information about that, you can email us at info@oppo.org or contact Vartan Abdo and he'll relay the message to me. But there's lots of hope at the end of the tunnel. Let's accept where we are. Let's be Armenian about it, and we will recover.
Dr. Larry Najarian, Dr. Matthew Nalbandian, thank you very much for your time and your effort and your expertise. Thank you very much.
Oh, thank you.
Vartan.
Happy.
Okay.
Doctor.
Good luck to you. Thank you very much.